Hello, my friend. This is Heather. This is the Back to Me podcast, and I'm super excited. Today is a celebrity chat with Dr. Elizabeth Davidson, and we are talking about how you can do things to take charge of your own health. And it's not as hard as you think. And she supports people along the way. And oh my gosh, I learned some really amazing things about how much you can actually already know because you live in your body if you pay attention. You can have a conversation with your doctor about what's going on with you and how to help you live your happiest, healthiest life. Have a listen. Let me know what you think. Share, comment, subscribe, send some love out into the world. Take care. I will see you soon. Hi, my friends. Welcome. This is the Back to Me podcast, and this is Heather, and I am super excited that you're here. You are going to hear some tips and some tricks and some ideas to help you live your happiest and healthiest self. I call it Back to Me because when you are taking care of yourself, back to me, then you can take better care of others, and we can all make the world a better place. This is Wellness Your Way, and I am super happy that you're here. Hello, my friend. How are you? I hope you're having an excellent day. This is Heather. This is the Back to Me podcast, and this is the Celebrity Chat Amazing Human edition, as always, on Fridays. And today's awesome human is Dr. Elizabeth Davidson, and we are going to talk about taking your health into your own hands, among other things. As you know, I tend to occasionally get distracted, but that's okay. As long as it's something interesting for you and helpful for you, then we are doing our jobs here. And yeah, so hi, Elizabeth, how are you?
I'm doing well. It's so nice to be here. Thanks for having me.
No worries. I was like, oh shoot, did the microphone turn off? But no, it's okay. Yeah, so we are going to talk all about health, but first, I always find it like massively interesting to find out how I know you do holistic medicine, but how you got into it and what kind of drew you into that, as well as what you're doing.
Sure. Well, I started out life really sick. So I started having migraines when I was about 4, and then joint pain when I was 7, and skin problems started at 11, and all kinds of gut issues. I took antibiotics a lot as a kid. I had bronchitis all the time. Like, I was just sick all the time. Like, I would miss 40 days of school a year.
Wow.
It was pretty miserable. And I got, all kinds of prescriptions. And I started recognizing that every time I took one of them, I felt worse.
Oh no.
What? This isn't how it's supposed to be. So when I was 10, I started refusing to take them and started doing things like changing my diet. I was doing elimination diets, though I didn't know that that's what they were called at that point.
At 10, you were doing that.
Yeah.
Wow.
I was pretty desperate. I'd already been sick for like all the time that I could remember. But I was recognizing too that my health wasn't coming from the things that I was taking, that health was really coming from inside me, and it was something that I could build and figure out. So I started playing with that stuff when I was a kid, and some things work, some things don't. I don't know. I've just been on that path ever since. It's still kind of the same sort of thing, like trying new things. And, I've probably tried every diet you can imagine. And I've tried all kinds of therapies and acupuncture and Chinese medicines and chiropractic and all the things. And then, wound up getting a doctorate so I could help other people with things. And I've really put everything I've learned together into something that's designed to help others that have dealt with similar things. And what's cool about it is that those people don't have to try everything and do all the things and get a doctorate and all of that. Like, I did all the work. So you can just like work with me and get all of my knowledge and experience. And
Right. It's so much easier if someone else has figured out most of most of the it's because I joke with my clients as well that, if they come to me with things, I'm like, well, I'll try that and see what happens and I'll let you know. Right? It's like I call myself the experiment of one. Let's see what happens if I do it and I can tell you what I think. But do you find that and I know what the answer is going to be, I think, that there isn't a one answer for every person, right? It's almost like each person is so different in what will work and what won't work. Or have you seen any similarities between people? Or
I mean, definitely similarities and definitely differences too. I mean, some people respond better to some other things, and everyone has some difference, of course. But I have found some things that are pretty consistent too. Like one of the things I do is I read people's blood work from a functional perspective, and I can find so much information in that blood work, and then support people in growing healthier from that. And that seems it's pretty consistent. Like lots of times the things that I find and then the solutions that work for people. Um, and it's, pretty consistent that if people eat less sugar and exercise more, they feel better, you know?
yeah, it's like that little quote I have attributed to the Buddha, knowing and not doing is not yet to know. So we know that we should eat less sugar and exercise more, but we don't really know it if we don't do it, right?
Yeah. But I also find that, something that I'll tell people, like, because I get asked about dietary stuff all the
Mm-hmm.
time. People
Mm-hmm.
always want to know, well, what should I be eating? What shouldn't I be eating? And that is really different for lots of people, though there are some similar things like what I just said. But what I help people to do is like, try it for a week, see what you notice. Like, try not eating sugar for a week, see what you notice. If you can't do it, that's okay too. That's something you notice. Um, and, and most people can try anything for a week. And just one of the things that I really want to bring to people is that noticing, because I find it almost amusing when you go to the MD like once a year, see the MD for 15 minutes, and they tell you so much about yourself, and you're like, really? and, and for me, my perspective is that, we all live as individuals, we live in our bodies 24/7. And so we know them better than anyone else. And if you can tune in and notice and trust yourself,
Right.
what you feel and what you think about what's going on, then that goes such a long way toward your healing, just that recognition. Um, and and I find that a lot of people get told kind of opposing views from their MDs, and then they learn to not trust themselves. And I think that's one of the worst things you can do for your health, is not trust what you know about yourself and what you feel about yourself. Um, so that is another thing that's really consistent over like all my clients is, just teaching them to trust their intuition about their health.
And it is interesting when you get that disagreement from someone that you see in a position of authority. You can say, because I can remember I have been to the doctor and said, there is something wrong. Like, I know there's something not right going on. And they'll look and they'll say, no, everything's fine. I'm like, no, it's not fine. Something's wrong.
Yeah.
And I mean, I trust my intuition with my body enough to know and to pursue it further. But some people don't feel that and they're just like, oh, I must be imagining. And, whether that develops into something worse or not, I don't, or just, I mean, ongoing suffering. And I remember there's, well, in Canada, he's quite well known, a fitness trainer who had cancer. He had polyps in his sinuses, but his doctors said there was nothing wrong with him. But he kept pushing and pushing, saying, no, there's something wrong. And they eventually did find it. But yeah, so I guess for for someone who knows, I guess, is the suggestion to get another opinion or to try something different? Or, I mean, sometimes you just feel like you don't have the tools to figure it out.
Yeah. Well, what I tell people is if you're learning something about your health, like if your doctor's telling you something or something doesn't feel right, then it's not right. So get another opinion. Like you can always get another opinion. And that's one of the things that I love to do for people is give another opinion, from a different perspective. And um, whomever you can find that you trust to do that is really good. But get as many opinions as you need to feel like you know everything you need to know and to feel like solid and comfortable in whatever is going on, to feel like it feels right, because
And don't spend all your time with Dr. Google, right? Because
oh, please don't.
Dr. Google tells you all the worst possible things.
Yeah.
I've experienced it. So it's like, oh my God, I have cancer. No, you don't. You have gastritis. Right.
Yes, I do. Well, one of the things that I do for my clients is that I'm always on call for them. Like they all have my phone number, and whenever there's
Wow.
a question, or well, what I've found for myself and my clients over the past 16 years that I've been practicing is that, you know, especially when you're chronically ill and you're trying to make big shifts in your life, that you need support. And yeah, I've had so many people who are like, yeah, this was going on in my blood work and I was trying to do this, but then I had this symptom from the medication. And so I tried to get in touch with my doctor and they didn't get back to me for 4 months.
Yeah,
Was I
I've seen
supposed to
that.
be taking the medication? Like, I don't know. What was I supposed to do? And I really want people to feel supported and taken care of. Um, so that's one of the big differences with me is that people get as much support as they can handle
And
because
that's amazing because it is, you don't know sometimes. I remember I had a client who was having a reaction to medication and her doctor said it wasn't and she couldn't get in to see her doctor. So she researched the medication herself. She said, no, it is the medication. So it's like, damn it. I want to go back a little bit because how is the blood work different than standard blood work that people get? Is it like
uh,
magic? I don't
yeah.
I don't know what I
I
mean,
mean, the blood work
go ahead.
the book itself isn't different. Like most of the time, I'm just reading whatever people have from their MD. Most of the time, that's totally fine. But I read it in a different way. So when you look at the so-called normal values, where do they get those values? Well, they get them from all kinds of people that came in and may or may not be healthy, and they're probably mostly men because most medical testing is done on men, and
Right.
so like and the ranges are so broad. And like I know the vitamin D range to the normal is what 25 to 100, but most
That's
people don't
huge.
feel, yeah, right, most people don't feel good until they're above 80, but they're told they're normal if they're at 25. And vitamin D, you need it to have all your cells work. You can't have an immune system or like a positive attitude if you don't have enough vitamin D.
Right.
And so if your vitamin D is at 25 and you're told you're normal, then what? So the ranges I look at, that's part of what I look at is the ranges, but I look at functional ranges. And so those are a bit tighter than the normal ranges that you would get from a medical perspective. Um, so I feel like I get more information there, but the key really is that I look at the relationships between the numbers.
Okay.
And yeah, which doesn't happen in normal blood work reading, but that's where I can really dig deep and find what's going on. And so much of it is in the most simple part of the blood work, which is just the CBC, the complete blood count, not the Canadian broadcasting.
Right. Oh, she knows Canadian broadcasting.
I grew up on the border.
Right. That's
Yeah.
awesome.
I could walk to Canada as a kid. Yes. The
That's
best
cool.
radio stations come. Yeah. Um, so I get so much information from that, which um, most when I look at that, people have never even heard of the things that I'm finding just in that. I can figure out if there are infections going on and what types of infections from looking at the percentages of the different types of white blood cells.
Whoa.
And so a lot of the time they don't even ask for the differential. So the differential is when it splits the white blood cells into all their different types and the red blood cells. And I can get so much information from that. And sometimes it's not even included. Really? That's where everything is.
Right. That's where the good stuff is.
So I can figure out from the complete blood count if people are able to methylate their B vitamins. I can figure out if they are iron deficient. I can figure out if they have a bacterial infection or a viral infection, or if they have parasites or a fungal infection. What else can I find from that? There's so much in that.
Wow. Yeah,
Um,
that's not something you get when you go to the doctor, like your GP. I mean,
no.
I can remember one year because I was seeing a naturopath and my GP at the same time, and my GP, I had my annual physical, and my GP said, "Yep, everything's great." But I had my blood work sent to my naturopath, and my blood work said, "Your iron is dropping. We need." I'm like, "What?" My GP said I was great. He said, "No, it's dropping. We need to get you back up on the iron." I'm like, "Whoa." But I was, like you said, I was in the correct range for my GP's purposes, but I wasn't in a great range for my health, really.
Yeah.
But that's amazing how much you can tell from blood. And
Mm-hmm.
it makes sense to me, but at the same time, I'm just like in awe of all the things we can figure out. And I guess if
Yeah.
you're looking at blood work and helping people, you don't even need to have them come into an office these
No, I
days.
don't. I work mostly virtually now. I mean, if people are local, I certainly enjoy seeing them in person, but um, I can find out so much from a case history and blood work, and then sometimes, like you were saying, your naturopath found your iron was dropping. Like I can look at years of blood work and see patterns in that too, and really dive deep into their health that way. And then I check in regularly too when someone like signs up and does a program with me. I check in, and so
And what
really,
is your program, like an educational program as well, or is it all just kind of analysis and one on? Do you do groups or do you just do one on one? So
I
many
have.
questions.
So I definitely do the one-on-one. I enjoy that a lot, and you get your individual blood work reading and protocol set up and check-ins with me. But I also have an online program where people can learn to do it for themselves.
Cool.
So they can learn to look for what they want to learn in their blood work, and how to address that and how to fix the problems, and then how to maintain it. So it's discover, reset, and maintain. And
And I guess if
yeah,
they're doing that and they run into problems, they can just always do a consult.
yeah, yeah. I mean, the online program also comes with the same level of support, but you learn how to do it, which is cool because I mean, it doesn't set you up necessarily to be like a practitioner. It's a lot better to do that if you have a doctorate, but you could look at your family's blood work and get an idea of what's going on for them, and then have a consult with me to confirm and move on to like a protocol to get well. So
Do you find that there's a lot of people suffering from like subclinical infections that they're not aware of? Is that a
yep,
normal thing going on in the world?
yes.
Or your world, I guess. Not maybe not the whole world.
um, Pretty much everyone, especially people who have chronic illness and autoimmune disorders.
Oh.
A lot of the autoimmune disorders, it's not just a bacterial infection, it's bacterial on top of viral, on top of parasitic, and it
Whoa.
all shows up in the blood work. Yeah.
And of course, me being like how do I not get all these things? But is it just part of life that these things happen and we just have the technology now to know? Or
I mean,
maybe you don't
if
know the answer. I don't know. Is it
if you've ever done anything that weakened your immune system, that opens you up for a chronic infection. So what weakens your immune system?
life?
Well, life, antibiotics,
Right.
sugar, um, not moving your body enough, sitting too much, breathing polluted air, like
So it is life, basically.
the isolation of the past few years. I've
Right.
certainly seen an uptick in autoimmune stuff because that's a huge has a huge effect on your immune system.
So just physically being isolated affects your immune system.
Well,
Or
your immune,
is it the lack of interaction?
yeah, the lack of interaction. Like, I mean, if you don't use your biceps, they're going to get weak, right?
Right.
The same with your immune system. If you don't use it, it's like, oh, I can take a break. I don't need to be strong. You don't need me anymore. So, uh,
Oh,
so you need to use it. And part of the way we use it normally is by interacting with people.
who have stuff.
Yeah, who have stuff, or even if they don't, you're interacting with their biome, all the bacteria and viruses and everything that they're carrying around, whether they're harmful or not, you're interacting with that
Wow.
anytime you touch someone or breathe near someone or hug them. And that's all information that your body takes in and your immune system reacts to and grows from. So that's all strengthening your immune system.
Which makes a lot of sense because, 3 years into COVID and this last winter when people started to go indoors again. And I don't know, I mean, here we had restrictions up until, the spring of 2022. So people finally started to interact and act in quotation marks normal again. People got so sick this winter. Just like all the colds and viruses that were lying in wait, all exploded onto the scene. So many people were sick for a month at a time because as soon as they got over something, something else would come because the kids were back in the classrooms and kids are petri dishes. So it's like so many people are getting sick. And I guess that's a byproduct in part of that lack of, our immune system lifting weights.
Yeah.
Wow. So not only is it bad for you mentally, but it's bad for your immune system to be isolated.
Well, and it's an isolation on an emotional and mental level is also bad for your overall well-being and your immune system and stuff too. But then on the physical biome level, it's bad. Yes.
Wow. And so it's interesting about the sugar. I spoke with a woman who does gut health. So she's specific, like a nutrition type person. And she told the story about when she went to get off sugar. And I don't know if you've had any people who could completely kick sugar, but she said 6 weeks into taking herself off sugar, her sister found her in the pantry weeping because of the sugar withdrawal. And it's a hard one to get off of because it's so prevalent in everything, even though we know we know more than we did before, all of the things that it's doing to us. Is there a way to help support people in getting off of sugar, or
Yeah, there
has
is.
anybody done it?
My daughter doesn't eat sugar at all.
Did she ever?
She did when she was younger, but she doesn't anymore. She's 14 and she doesn't.
Wow,
So
she's my hero.
it's pretty amazing. Um, so a big part of my like introductory protocol is often a gut reset, where I use supplements to clear out any of the junky bacteria, yeast, viruses, parasites, any of that stuff, and then reset the gut with healthy stuff with a prebiotic and a probiotic and all of that, so that people's guts can function again. And so much of that sugar craving comes from like yucky bacteria and stuff in your gut. So that can help a lot. But of course, there's also like the kind of mental emotional addiction to the sugar too, which is trickier. But that that thing that I do where like try it for a week, see what you
Right.
notice. And then if people can manage to not eat sugar for a week and then they do eat it, often they notice that they feel terrible when they eat it.
Right.
So that helps a lot to recognize how it makes you feel, because you can't recognize how it makes you feel if you're eating it every day.
Right.
But if you can go without it for a week or longer, if you can manage it, and then you put it back into your body and see how you feel, you're like, oh, that is not good. And um, so that helps for sure.
Does honey count as sugar?
I mean, for,
You can be brutally honest. I can take it.
I I love honey.
I know, me too.
I think honey has so many beneficial things in it too. I mean, I wouldn't try to like as much sugar as people eat, like don't eat that much honey. But
Right.
if you really can't get past a sugar craving, yeah, have a spoonful of honey. It's going to be a lot better just because it's a much more whole food, and it has, the bees put so much magic into that. So um,
Right.
yeah, and maple syrup, same sort of thing. If you need a teaspoon of maple syrup here and there, like I wouldn't eat pancakes anyway, but I wouldn't drench stuff in it. But maple syrup also has, lots of minerals in it and all the good stuff from the trees. And I live in Vermont, so um,
You get good maple syrup.
yeah, my daughter
Right.
makes it.
Oh
So,
my God. Your daughter's my hero twice over.
oh, if you knew everything about her, she'd be your hero like 100 times over. She's amazing.
Okay. Okay. And the thing about pancakes, so I mean, it's become quite popular to be gluten intolerant, and not to say that people aren't, but do you? I know people who are celiac, so it's like there is a difference between celiac and just choosing not to eat gluten. But do you, as part of your protocol, a kind of a gluten elimination? I just think of the major contributors like dairy, gluten, sugar.
Um, Not necessarily. I'm more concerned with the gut health. And what I find too is with the gut reset that I do, often people who were gluten intolerant can tolerate gluten again.
Wow,
And I find that with a lot of food allergies, that the food allergies and sensitivities are really coming from an unhealthy gut. And when you fix the gut, then the allergies or sensitivities go away.
amazing that there's hope for people who love bread. But
I mean, I don't think bread should be like your main food group,
I know.
but also I believe a lot in pleasure and fun. And if bread really brings you pleasure and you eat it once in a while, and I think that's fine. Um, Especially
There,
if you're like good quality, like we get this a friend of mine that I have dinner with sometimes. He gets the sourdough bread that's got all locally grown grains in it. I'm like,
no,
that seems pretty okay.
that seems pretty okay. I'm okay with that. Yeah. Um, I know it's like you can't, it's like there's a trade off between being 100% absolutely perfect in everything you do and miserable
Yeah.
and but doing everything that's not good for you and being sick. Somewhere in the center there is your happy medium of have some fun, have some enjoyment, not be sick all the time, feel energized, feel happy. Do you find it also helps the reset helps people's brains function better?
Oh, hugely, yes.
Yeah.
Brain fog goes away. Lots of times, anxiety and depression go away.
Wow.
Um, yeah, it's a big thing for sure.
Amazing. Yeah, I have anecdotal from people who have cut out various things and said that suddenly they were smarter. It's like, oh, yeah, it's like you were smart the whole time, right? And what is so your is it a self study? Is that what you call it? No, what's it called?
The online program.
The online program,
Yeah,
and it's on your website.
it is.
And is it what is your website again? Just we're going to put it in the show notes, but for people who are listening,
It's drelizabethdavidson.com. DR, not doctor spelled out.
DR, and there's no dots or underlines and all that.
Oh,
Beautiful. And so, are you restricted by geographics, or can you help people anywhere on the planet?
I can help people anywhere.
That's awesome.
Mhm.
That's awesome because I know there would be people, there's people who listen in different parts of the world. And if they are super curious and they just want to feel awesome,
Yeah.
then it would be awesome if if you could help them feel better. And I just got a whole whack of blood work done not too long ago. I'm like super curious now to go and figure it out.
Cool.
I love learning new things. Oh my God, it's so amazing. I didn't know how much you could figure out from blood work,
Oh,
but
so much. So much stuff.
it's super exciting.
Yeah.
So, yes, my friends, I'm going to always encourage you to find Dr. Elizabeth, and because I want everybody to feel good and feel better and be the best selves in the world. But before we do anything else, I'm going to ask Dr. Elizabeth if she has a final several words of wisdom for people.
Oh, which words of
Oh,
wisdom?
as many as you want.
I mean, one, it's easier to stay well than to get well.
That's so true.
So, it's one thing that I've done with my daughter is really just been growing her health since I was pregnant with her so that she could stay well. And I love helping people get well and then stay there. That's so huge for me. And I don't really want people to have to keep, taking supplements or medications or whatever for a long time. I want to address the problem and get them well. So that's one thing. And then a recommendation that I have for people is to take some time for yourself every day. Like, even if it's only 10 minutes, guard that 10 minutes and, make sure your kids and your spouse and your dog and whomever needs to knows that 10 minutes is just for you. Don't be scrolling on your phone and don't be like doing a chore or checking off your list, but take that time to be with yourself, reflect on how you're feeling, what you need in the moment, all of that. And just checking in with yourself like that every day can go a long way. And really trusting what you find, because trusting, we're all intuitive, whether we think we are or not. But if you've ever had a gut feeling, that's intuition. If you've ever just felt like something's right or something's not right, that's intuition. And we are all intuitive. We all have that. And it's something that you can grow. And but when you recognize that you have intuition as a superpower that we all have, I think you can really go a lot deeper into your health and who you really are, and and having that and just having confidence in what you know about you. So that's really important to recognize.
That's awesome. That's some awesome wisdom going on there.
Cool.
Thank you so much for coming and hanging out and sharing all of this information. Like my mind is just got so many I'm just like super excited about all the things that can happen when
Cool.
we're healthy and well, right? And I mean, I am on a continual journey to make sure that I stay healthy,
Mhm.
because it did take me a while to get healthy. So I totally think that's awesome. Thank you so much. Thank you. Thank you.
Thank you.
And you stay well.
Yes.
And my friends out in podcast land, you stay well. Check out Dr. Elizabeth's website. Go and check out the online thing. Hey, pull out your blood work. Who knows? You might learn something that'll just blow your mind. That'll be so cool. And of course, always Give us a comment, let us know how you're doing, and share it with someone who needs the information, right? We gotta like share things out into the world that are helpful.
Yes, please.
Thank you so much. Thank you, thank you, thank you. Have an amazing day, my friends. See you next time. Hi, my friend. Thanks so much for listening to this entire podcast. If you found it useful and you're like me and you like helping others, please feel free to share this. Give it a like, give it a comment. If you found something useful in it, there's a chance that someone else will find something useful as well. Also, if you have any questions at all, I can absolutely help, and I would love to help. You can email me at heather@prosperityflowcoaching.com. If you want more of this awesome content, you can follow me on Instagram, Heather Stewart Coaching. You can follow me on Facebook, Prosperity Flow Coaching. And I have a personal request. I want to help as many people as I can with these podcasts. And if you could give me a review, hopefully a good one, if you could share, if you could send this out into the world, I would truly appreciate it. I hope you have an amazing day, and I hope that you find your way to wellness by getting back to me. Take care, my friend.